When we're looking at, all the things from rural health transformation, we just talked through many of the ways that Avel can be a part of that solution. As now a government leader, a policy leader, a healthcare leader, what am I thinking about right now for my next steps? Like, what's going through my head about what do I need to do right now?
Yeah, that's a great question, and I have those conversations multiple times a week. I recently got just a text, a random text, and hey, do you have a second to talk? And I said, of course. And so I gave him a call, and he wanted to know more about rural health transformation in his state.
Okay.
And the topic had come up around behavioral health in particular, and one of the services that we provide in a number of states around the country. And supposedly there was a conversation about lack of access to care, local, not enough people to care for the people.
Yeah.
And so, those types of questions are happening. But, the other side, from a rural health transformation, a lot of these policymakers are fatigued.
Okay.
And they're fatigued because there's been such a short window.
Okay. Yeah.
From when the legislation was signed in July, the notice of funding opportunity came in September, the applications had to be in November, and then they got their initial response back at the end of the year. But also at the same time, everybody's calling. Everybody wants to set up meetings to talk about A, B, C, or D. And, and so there's a lot of public folks that have just kind of, they won't respond to their emails. And I've heard this locally and nationally that because it is a public procurement process, to follow the process, they need to stay to follow those guidelines. And so, there's a little bit of fatigue because it's such a big topic. Yeah. And there's so broad pockets that organizations and communities can act upon. And, there's a state yesterday that they had a large RFP package come out, but it was rural hospitals, federally qualified health centers, not-for-profits, and one other group of organizations that's all that they were going to fund with that one. So, they're just setting the rules and expectations.
Yeah, absolutely. Well, and I can see why it'd be fatigued because it probably feels lonely too. Like you don't really know how to do this. So when we are looking at this, what does the partnership level look like? Or how do we make sure that people can work together to truly get what's out of this funding?
Yeah. Sustainability is key. And having a good partner is wildly important.
Yeah.
And, we've got some great, not only hospital partners that we work with every day, but we also have some great cohorts that we built. Like Sabolo Health, phenomenal little organization that is, really working about changing payment methodologies. How rural healthcare organizations can grow and thrive and survive in these times. And fortunate to be their telemedicine partner. And, they've got a big footprint and growing every single day. And so, that's just one example of collaboration and building cohorts to not only build on that relationship, but also for their members. Yeah. And so that's an important piece of this too. Yeah. Is not only that direct stuff that we work with every day with governmental entities, but it's those collaborations that's going to be key because again, it's all about sustainability. Yeah. And being able to, once the federal funding shuts off in 5 years, continue to grow and thrive from there.
Yeah.